The consultant, do you know why you're here? You're having a heart attack and getting sorted out.
Of course, we all think that we are invincible. Nobody thinks you'll end up in A&E, or as it happened in my case, my father was brought into A&E following a collapse at home. Once in A&E, things move very fast. He received a scan that identified that he had a stroke and also a small tumour.
First thing this morning has come via A&E. They've had a series of symptoms that are indicative of the patient having a stroke, and as such the patient has been seen by a team of nurses and doctors who have decided that a CT scan is appropriate. A CT scan is an examination that takes 2 or 3 minutes. It's very sensitive at picking up abnormalities in the head, particularly strokes. So Mr. Guinness has come to us this morning. We've got him in very rapidly, and we're now going to do a CT scan of his head, which, as I say, takes about 2 or 3 minutes. So the patient has to lie nice and still. We utilise an X-ray system to produce images of the head, and once done, those images are viewed by a radiologist.
My father was then moved to a ward where he underwent further tests.
Hello, I'm Sally Bailey and I'm the phlebotomy manager. Our job in phlebotomy is to take bloods from patients and get them to the lab where the samples are tested.
A blood sample was taken and sent off to the laboratory.
We take bloods from about 450 patients on the wards each day and around 300 patients in our clinic each day, including babies and children. These patients can have tests requested from their GP or doctors in the hospital. We have 35 part-time phlebotomists that cover the wards and the clinics. We aim to get the samples from the patients on the ward to the laboratory by lunchtime each day, enabling the doctors to get their results back early in the afternoon to help them make decisions about treatment for the patients and if they can be discharged home.
My name is Alistair McCartney. I'm the Chief BMS in the Haematology lab. Basically what haematology does is the full blood count and coagulation testing. What we do is we measure your hemoglobin, your white cell count and your platelets, and we also look at the risk that you will be bleeding disorders. How the lab works is we have automated trachea for our full blood counts. We process around 3,500 to 4,000 samples a day. That translates to around 900,000 full blood counts per year. For coagulation, we process around 500 samples a day, which translates to around 150,000 samples per year.
Hello, my name is Tracy McConnell and I'm a senior biomedical scientist in the blood transfusion. There are approximately 5 members of staff that work here every day, and we cross-match over 17,000 units of blood a year for patients in the local community. And it's approximately 100 to 120 samples are processed every single day to determine a blood group and an antibody screen here at the Norfolk and Norwich Hospital.
Hello, my name is Susan Kerry. I'm Chief Biomedical Scientist in Laboratory Medicine, covering the sample reception area where all our blood samples and urine samples arrive, and covering our automated biochemistry department, which analyses your samples, so that we can process the samples accurately for the patient's safety, so that the right blood test results go to the right patient. We scan in the barcode on the request form and then place barcodes onto the patient's samples. This is the module that we use to process the biochemistry samples. The robot picks the samples up, it takes them along the track, it reads the barcode. The samples are then centrifuged over here, and then once they've been centrifuged to separate the serum, they then go over to our various machines that are around on the track. Those machines are then able to analyse the samples for the test requested by the doctor or your GPs. Our numbers that we deal with here at the Norfolk and Norwich on a daily basis are around about 15,000 individual tubes of either blood or urine.
As they had noted a small tumour, the consultant advised that a biopsy needed to be taken and sent for diagnostics.
Hello, I'm Ellen Isaac. I'm a biomedical support worker in the Histopathology department at the Norfolk and Norwich Hospital. The patient had a biopsy taken to be able to determine which type of tumour the clinician was able to see. Once it had arrived in our department, it was then dealt with at our reception and then dealt with in according to our procedures, where it is fixed in formaldehyde and processed overnight. The role of histopathology is to analyse the tissue samples collected from the operating theatres, outpatient departments and GP surgeries, and provide clinicians with diagnostic and prognostic information to help them treat their patients. The histopathology department at the Norfolk and Norwich handles approximately 62,000 patient samples each year. The majority of these are from the NNUH, James Paget and local GPs. Each sample is preserved using a formalin fixative, dissected and then infiltrated with paraffin wax, which provides a supporting medium for the tissue. Depending on the tissue sample, this process can take from 2 hours to 3 days. This wax block can then be thinly sliced and placed upon a microscope slide and stained with various dyes. The slices are so thin they allow light to pass through them, and the cellular structure of the tissue can be viewed under a microscope. Pathologists view these slides alongside the patient's clinical history to ascertain the disease processes. These results are then fed back to clinicians via the Trust's computer systems, and where necessary, face-to-face multidisciplinary meetings where many key medical staff can discuss the treatment pathways of individual patients. The abnormalities in the cells and tissue that histopathology detects are key for the diagnosis and treatment of the cancer, inflammatory conditions and infectious diseases.
Further radiological investigations took place.
My name is Matthew Gray. I'm a nuclear medicine physicist. On this workstation here, we acquire the set of images, which takes around about half an hour, 45 minutes. We then fuse the images and send them on to our archiving system for our reporting doctors, and later on they're discussed in our multidisciplinary meetings. Our department is expanding year on year. We're seeing more patients for diagnostic and therapeutic indications. Our staff are very qualified to cope with this sudden increase in the number of patients coming to see us. With the fact that we are a university hospital, we are very much part of the teaching is within our remit as well as mine, and we are teaching the next wave of radiologists coming through, hoping to keep them on here, expanding and growing, making the Norfolk and Norwich a better hospital every year.
My name is Ragurajan. I am the MRI service lead overseeing MRI services. We provide diagnostic services to our over 30,000 patients a year across Norfolk and surrounding area. Our service is extended to provide 24/7 MRI services, including emergency on-calls. MRI is considered to be safe and advanced imaging modality compared to other modalities. MRI does not use ionizing radiation to acquire images like CT scan. MRI is considered as the gold standard diagnostic tool in clinical conditions like cancer, brain, musculoskeletal pathologies, due to its ability to produce high quality soft tissue information. The radiology department is affiliated with the University of East Anglia, and together we aim to provide the highest standards in medical imaging.
The pharmacist visited him daily and prescribed appropriate medication.
Hello, my name is Ewan. I'm one of the pharmacists here at the Norfolk and Norwich Hospital. I've been working here for about 9 months, and I did my training here at the University of East Anglia as well. I really enjoy working here. There's a team of maybe about 200 staff here in the pharmacy department, and I work predominantly on the wards. I see up to 100 patients a day if I'm looking after 3 wards in particular, and I get to speak to them about their medications, I take an accurate drug history when they first come into hospital. When they go home from hospital, I speak to them about all their new medications, how to take them, when to take them, side effects to look out for, and try to make sure that their medications are completely optimised. I try and make sure that all the patients get the right medication at the right time, and that they are utilising all the medications that they're taking. So we have 4 robots here in the hospital pharmacy department. So you can work on the computers and you can ask for it to give you this medication. The 4 robots work in here. They go along these conveyor belts and then they can shoot across the top, and then they can actually come down to the computer where you've asked for them to appear. When the wards want stock for all their medications, they can put them onto an order form, and the order form spits them out of here and into the correct boxes to make sure that we minimise the risk of medication errors.
While on the ward, my father's monitor stopped working. A lovely man from clinical engineering came and immediately replaced the monitor.
I'm Paul Chapman, Acting Head of Service for the Medical Illustration Department. We specialise in clinical and ophthalmic photography, graphic and medical design, multimedia and filming services. We process more than 40,000 patients a year, 6 days a week. Our service covers 3 sites: Cromer Hospital, Central Norwich Eye Clinic and the Norfolk Norwich Hospital. We record conditions working in a modern photographic studio, clinic, ward and operating theatre environment. Our clinicians require the highest quality images to record the patient's injury, disease, progress of the operation or medical procedure to make valid judgments regarding their condition, enabling them to receive the best possible care here at the Norfolk Norwich University Hospital NHS Foundation Trust.
Luckily, the tumour was found to be benign. The stroke, however, affected my father's ability to swallow and speak, and he needed help to walk.
Right. Did you need any surgery to your neck or anything?
The professionals worked together as a team. The dietitians recommended an appropriate diet so that my father could swallow, and therapy improved his ability to swallow.
Hello, I'm Emma Banham and I'm the Specialist Dietitian for the Stroke Unit. I work as part of a team of dietitians who assess and treat nutritional problems. On my ward, the main nutritional issue is swallowing difficulties caused by a stroke. Today I'm seeing a male patient admitted to an A&E a few weeks ago with a stroke and suspected tumour. He is unable to swallow any food or drink safely and has a nasogastric feeding tube. We've calculated his calorie and protein needs and devised a feeding regime to provide all his fluid and nutrition. Often following a stroke, patients with swallowing difficulties need thickened fluids or modified texture foods. Dietitians will advise on these, and if a patient is losing weight or struggling to eat and drink, we discuss their food and drink preferences with them and recommend high calorie and protein meals or snacks. Sometimes we prescribe specific nutritional supplement drinks to be taken between meals. These contain additional calories, protein, vitamins and minerals. Essentially, we support patients to eat and drink to their optimum so that they can improve their strength and recovery following their stroke.
The physiotherapist saw my father daily and helped to aid his walking so that he could walk to the toilet and back on his own.
Hello, I'm Jane Purser, Service Manager for Occupational Therapy Department. The department consists of 120 staff. We provide a service to in and out patients, and each month we receive around 1,000 new referrals. We provide an inpatient service to all clinical areas. Our role is to ensure the safe, effective and timely discharge of patients. This involves the assessment and treatment of an individual's physical, psychological and social health. We work closely with relatives, carers and other public, private and voluntary organisations. When a patient is medically fit, timely discharge is facilitated by our integrated home-based therapy service, who can complete the assessment in the patient's own home. A safe discharge is ensured with recommendations for appropriate care packages and the prescription of equipment and assisted technology. We also have a hand therapy team which is integrated with physiotherapy, which provides a regional service. We see patients on the wards, in our Activities of Daily Living assessment flat, in outpatient clinics and in their own home.
Hello, my name's Anna Osborne and I'm one of the speech and language therapists working in the stroke speech and language therapy team. We also have an acute team and a head and neck team within the hospital, and last year we saw over 2,000 inpatients across those 3 teams. Speech and language therapists work with adults who have problems with communication and also with swallowing. We help to identify any communication difficulties a patient might have and provide information and advice on how best to communicate with that patient. Some of our patients might also experience difficulties with swallowing. Following assessment, we would advise the medical team if a patient is able to eat and drink safely, which means without their food and drink going down the wrong way or being aspirated. Speech and language therapists work in partnership with individuals and their families and with other professionals and agencies to reduce the impact of these often isolating difficulties on people's well-being and their ability to participate in daily life. If a patient came into A&E with a stroke and a suspected tumour, we would screen them for any swallowing and communication problems. And depending on our findings, we may suggest methods to facilitate their communication. Techniques might include picture charts, certain apps on the iPads, or writing things down. With regards to any swallowing impairments, we may suggest modified diets and fluids. And if the swallowing difficulties are very severe, we may suggest keeping a patient nil by mouth with supportive non-oral feeding.
Hello, my name is Lizzie Axley and I'm Dementia Services Manager. Up to a third of our patients at any one time are living with dementia, so it's really important for us to make their experience the best it can possibly be. Our dedicated and highly acclaimed dementia support team assists patients and their families wherever they're cared for in our hospital. Patients are supported by engagement in activities which have meaning to the individual and promote well-being or help them to feel calm so that they can have the treatment they need. Our nurse in the team supports those with complex nursing needs, sharing techniques and expertise with the teams. Families and patients are offered emotional support and advice, and the team makes sure they're connected with services to help them keep well now and in the future. The team also supports the Trust's dementia strategy work, such as dementia awareness training and promotional events, best practice initiatives and our 140 dementia links trust-wide.
Although a lot of people were involved with my father's care, he felt lonely, isolated and vulnerable. On finding out that my father was a church attender, the hospital chaplain visited on a regular basis, and my father was overjoyed to be taken to the hospital chapel on Sunday.
Many people in hospital find that they need to talk, and whether visiting at the bedside or when patients and relatives drop by the chapel, chaplains can give time. Listening in a compassionate and non-judgmental way for people of all faiths and none. We were pleased this patient enjoyed his Sunday service and the peace and stillness of our chapel garden. There's always a chaplain to help.
My father is now at home. The occupational therapists worked with me to ensure that my father could cope in his home environment and made an onward referral to social services for additional support. The medical and nursing teams provided an excellent standard of care throughout my father's hospital stay. However, I did not realise the impact of the additional services that helped in my father's recovery. Since discharge, my father has received a follow-up appointment to see the consultant.
Hello, I'm Carol Farrow, Chief of Division for the Clinical Support Services at the Norfolk and Norwich Hospital. This short film is to provide you with an insight into some of the clinical support services and the work they do on the wards. There are some clinical support services that are not mentioned, for example, psychology, health records. They all provide vital support to patients and the healthcare teams. The film highlights the continuous services our teams provide to give you the best possible treatment. Thank you for taking this journey with us.
This was my story in dealing with my father's unexpected collapse at home. I felt privileged and protected to see that the golden thread in patient pathways was so well defined here at the Norfolk and Norwich University Hospital, and I hope that you don't need it anytime soon, but feel good to know that they are ready anytime we need their help.